My name is Chris Runge, and I'm a PhD audiologist at the Medical College of Wisconsin, and I work with Frederick Hospital and Children's Hospital of Wisconsin. And we have a collaborative, multi-institutional, multidisciplinary project to test newborns genetically for hearing loss. And so we're really hoping that this will help us treat our babies better and be able to identify hearing loss very early at birth, in addition to the newborn screening that we already do for how the hearing system works. So if we can find the genetics, that should really help a lot. And the American Hearing Research Foundation has graciously provided us with funding to do this. This is a project we've wanted to do for about 2 years, but couldn't find the funding to do it. And so this is our opportunity to really get this program off the ground. And the important part about doing a genetic screen is when we do the physiologic screen now, which typically a baby would come in and after they're born, they get an auditory brainstem response. And that measures the response of the hearing nerve and the hearing neural system that in the brainstem that will tell us if the sound is getting from the ear up through the system to the brain. If the child doesn't have hearing loss at the time of that testing, so right after birth, but they could develop it later, we won't be able to tell that at birth. And in fact, if you do the physiologic screen, or the ABR, and the child is at risk for developing hearing loss later, it can set up the parents to think that hearing isn't a problem, so even if they notice something later, they might not be aware that it's hearing because they passed the screen. So if we have some sort of genetic information or even some other information about their health, then we can counsel the parents to still keep an eye on the hearing even if they passed the screen in the first place. Wisconsin is a leader in genetic newborn screening, and so this is a perfect place to start an initiative for newborn genetic hearing screening. And the genes that we're going to look at are the most common genetic causes for hearing loss at birth. The connexin 26 mutations are the most common genetic mutations. We'll also look at mutations that cause Pendred syndrome. Those are mutations that can cause hearing loss that actually appears later, usually in childhood. So that might be something that the newborn physiologic screen would miss, and so these children are actually at risk for developing hearing loss later. And so this gives us a counseling tool for parents if they do have these mutations, as far as looking out for hearing loss and trying to prevent it as long as possible. The other mutation we're looking for is a mitochondrial mutation that leaves someone predisposed for hearing loss if they receive certain types of medication. And so this is really important information to have, so if we know they have this mutation, we can guide future clinical practice to not give them that certain medication, and they can get different ones in case they become ill. That way we can prevent them from suddenly losing all of their hearing. And so hopefully we'll have some preventative measures in this as well, and that's how the genetic screening can supplement the physiologic screening that we already do.